Welcome to today's video presentation. I'm Dr. Nkendong, a psychiatric nurse practitioner, and in this video, I will delve into a fascinating and vital aspect of mental health and the cultural aspects of anxiety. I will discuss how cultural factors shape the perception of anxiety, the stigma often associated with mental health issues in various cultures, and how these elements can impact both the recognition and treatment of anxiety disorders. Before I go any further, I would like to say this information is intended for educational purposes only and is not a substitute for professional medical advice. Always consult your healthcare provider before making any medication or lifestyle changes. Anxiety disorders, as defined in the DSM-5, encompass a range of conditions characterized by excessive fear. However, the interpretation and expression of these symptoms can vary significantly across different cultures. For instance, the concept of ataque de nervios common in Latino cultures closely resembles symptoms of panic attacks and generalized anxiety disorder, but has culturally specific features like screaming uncontrollably and a sense of being out of control, which are not typically emphasized in the DSM-5 criteria. Clinical evidence suggests that cultural factors play a crucial role in the manifestation of anxiety. A study published in the Journal of Clinical Psychiatry found that Asian Americans often express anxiety symptoms somatically, such as reporting more headaches and chest pain, compared to Western populations who might express anxiety more cognitively or emotionally. This underlines the importance of culturally sensitive diagnostic criteria, as reliance solely on DSM-5 might lead to underdiagnosis or misdiagnosis in certain populations. Cultural stigmas around mental health can also impact the presentation and reporting of anxiety symptoms. In many cultures, discussing mental health issues is a taboo, leading to underreporting of symptoms. This is supported by research published in the American Journal of Public Health, which indicates that cultural stigma can be a significant barrier to seeking mental health care, particularly among African American and Hispanic communities. The solution lies in culturally adapted therapy and interventions. Clinicians need to be aware of these cultural nuances and adapt their diagnostic and therapeutic approaches accordingly. For instance, integrating somatic approaches in treating anxiety in populations that express anxiety physically can be more effective. This might involve a combination of traditional talk therapy with body-focused therapies like progressive muscle relaxation or acupuncture. Additionally, community-based interventions have shown promise in cultures where family and community play a significant role. Programs that involve family members in the therapy process and utilize community resources can be more effective in these cultural contexts. For example, a study published in the Journal of Consulting and Clinical Psychology found that community-based, family-focused interventions were effective in reducing symptoms of anxiety in Hispanic populations. Language and communication style are also crucial in treating anxiety across different cultures. Providing therapy in a patient's native language, or at least having a therapist who understands the cultural context of nonverbal cues and expressions, can significantly improve therapeutic outcomes. Research in the Journal of Multicultural Counseling and Development highlights the importance of linguistic and cultural congruence in therapy, particularly in building trust and understanding with patients from diverse backgrounds. Before I conclude, this video is sponsored by the Forgotten Healthcare, a 6-part series that sheds light on the importance of mental health to break down the stigma and educates about the different illnesses and the different types of healing modalities, as well as celebrate the helpers who dedicate their lives to help others heal and experience joy. Watch now on Amazon Prime Videos. In conclusion, a culturally informed approach to diagnosing and treating anxiety is essential. This involves recognizing the unique ways in which different cultures express and experience anxiety, and adapting diagnostic criteria and therapeutic interventions to these cultural nuances. Leveraging community and family-based approaches where appropriate can also provide more effective, empathetic, and inclusive care for those suffering from anxiety across diverse human cultures.